This topic I came to talk to you about today is very sensitive. It's sensitive for a number of reasons. I came to talk to you about female genital mutilation, popularly called FGM. So while conducting research on this topic, I saw a comment online that stood out to me. So the person said most victims of FGM do not even come out to talk about it. They insist they are fine, and most of the side effects, they cannot relate to it. The person asks, does this mean that we are crying more than the bereaved? So comments like this discourage people from talking about this practice. But anyways, we're going to talk about it today on this channel. So please give me a few minutes of your time. Let's go. So the person said most victims of FGM do not even come out to talk about it. They insist they are fine, and most of the side effects, they cannot relate to it. The person asks, does this mean that we are crying more than the bereaved? So comments like this discourage people from talking about this practice. But anyways, we're going to talk about it today on this channel. So please give me a few minutes of your time. Let's go. Before I get into this video, I want to send special thanks to victims of FGM that have actually come out to raise awareness on these harmful cultural practices. Thank you so much for all the work you do. So there is so much denial on the victim's side, and I further researched and I saw that this is part of the psychological trauma that comes with it. They do not think, victims of this practice do not think any harm was done to them because of how it was presented to them. Imagine telling, in most of their communities, they're told it's a coming of age practice. So it's something to look forward to. So we do not entirely blame the victims. We are not doing victim blaming here. We are just sending special thanks to people that have used their platform to raise awareness on this harmful practice. So female genital mutilation is a harmful cultural practice that involves partial or total removal of external female genitalia for no medical reasons. This is a form of violence against women, and it's a very terrible cultural practice that aims to control and to inflict pain on women. It is an outright violation to human rights too. This practice is common in almost, if not all, the countries in Africa. You name them, with Somalia being the highest in this group. Somalia, Djibouti, Chad, Sierra Leone, Liberia, Nigeria, a lot. So we are talking about this practice today. The weird beliefs that are attached to FGM, they are almost unbelievable. Some communities believe that FGM helps to sort of instill some moral righteousness in their female children. Some believe it curtails promiscuity. For some communities, it's a coming of age ritual. For some communities, it's for preparedness for marriage. A whole lot of weird cultural belief systems. Some communities actually cut their girls as soon as they are born. For some communities, they wait till when they're getting into teenagehood, and then that's like ushering them into womanhood, and then they commit this violent crime. So there are 4 different types of FGM. The first one being the clitoridectomy. That's the total removal of the clitoris. The second one is excision. In excision, the clitoris and parts of the labia minora, that's the clitoral hood and all of that, is removed. The third type of FGM is infibulation. In infibulation, it is cut and then the labia is cut and then narrowed and repositioned. Sometimes it's being sewed together to make the opening more narrow. Then the fourth type is other forms. The pricking, the piercing, the scraping, all other types of mutilation fall under the fourth type of female genital mutilation. There are consequences to FGM. I also want to say in this video that there is no good side to FGM. Yeah, usually things come with the negative side and the positive side. I really want to state in this video that there is no positive side to female genital mutilation. So the consequences range from physical health risk, that's severe pain, bleeding, infection, and complications during childbirth. The second is the emotional consequences. Some people develop anxiety, depression, and then we cannot live out post-traumatic stress. I mean, I'm not saying it's better to cut them when they are babies, but some of these girls are being cut when they are like going into teenagehood, and for some of them that's a memory they cannot erase. So the consequences range from physical trauma, that's severe bleeding, infection, pain, and other complications during childbirth. And we also have the emotional and psychological trauma, from the anxiety to depression to post-traumatic stress disorder, that's PTSD. And I even mentioned one at the beginning of this video, that's victim denial. They do not even believe harm was being done to them. That's a psychological trauma. Then sexual health problems like dissatisfaction, obstetric complications like increased risk of cesarean sections, prolonged labor, and fetal distress. In some very terrible cases of FGM, the types that it's sewn short, some of these girls experience return products during menstruation. It's that bad. But I came bearing good news. So there are surgeries that actually reverse FGM now. There are different reasons for FGM, like I stated at the beginning of this video. In some communities, it's done to preserve virginity, increase marriageability, to bring family honor, maybe coming of age practice, preparedness for marriage. And it's also done sometimes due to misconception on cleanliness. Some communities actually believe that women that are cut are less likely to develop like infections and all of that. So there are a lot of misconceptions and a lot of reasons why some people, and it's mostly practiced in rural areas, but you'll be surprised, it happens in even developed countries. I saw a woman that said she was caught in Texas. Are you serious? I thought it was just in developing countries, but I saw cases like that too. So there are a lot of misconceptions and reasons why people still practice FGM in this date and time. So to international organizations' credit, like World Health, there have been calls to totally eliminate this harmful cultural practice. There are even policies and bans in place to eliminate this particular practice. There are national laws and policies in place in some countries too, and there are also support groups for survivors. So the thing is, if you're a survivor of this, you should actually lend your voice, call for more awareness, because there's a particular African country, either Zambia or Gambia, that I saw. It was actually made a felony and people were trying to repeal that law. I don't know why anyone want to do that, but it didn't go through, to the glory of God. So if you're a survivor of FGM, I'm sending you love and light. You should join support groups, try therapy, and you should also explore that option of the surgery to reverse that practice. Please reverse that harm that was done. Thank you so much for stopping by. I hope you got value, and I hope you stop by next time. Please like, share, subscribe, and drop in the comments. Drop in the comments, is this practice done in your community?